Polycystic Kidney Disease, or PKD for short. PKD is actually very common. Most people have never heard of it. Try saying Polycystic Kidney Disease 10 times fast, so that's tricky. It's a disease that affects about 600,000 people in the US alone, and many millions worldwide. So it has about a rate of 1 to 500, so affects roughly 1 in 500 people, and is considered the most common life-threatening monogenic disease. And monogenic essentially means that only one gene needs to be affected, and that leads to the disease. So it's a dominant form, which means somebody has inherited the gene and they will have the disease. And there's very similar incidences in all over the world, so there's not really any hotspots anywhere. But it is possible that the rate of progression has gotten worse over time, right? So right now, people with PKD tend to progress when they're in their 40s, 50s, 60s. They will progress to kidney failure. So their kidneys kind of enlarge over time. There can be thousands of cysts that form in those kidneys. And normal kidneys, have the size of fists. You have two fist-sized kidneys in your belly, essentially. And in polycystic kidney disease, these kidneys can just enlarge to football size or even more, and that causes all kinds of problems. Obviously, pain is a big problem, and at some point these kidneys become non-functioning, and the patient would be at end-stage renal disease, which means they have to go on dialysis and hopefully can get a kidney transplantation. So people can know early on when the symptoms are not really severe yet. One of the earlier symptoms is usually hypertension, high blood pressure. So that tends to be the earliest treatment. Then later on, as kidneys progress, the kidney growth progresses, and the disease progresses, it essentially stays like that treatment-wise. The common recommendation is essentially go on blood pressure medication, drink more water, avoid salt, and there's only one actual FDA-approved drug available that is unfortunately only available to sort of a subset of patients, usually the rapid progressing patients that are not too old yet. There's a bit of a age cutoff there. That particular drug does not cure the disease or reverse the disease. It only slows down the progression by a bit. Unfortunately, this medication is also very, very expensive, so it's essentially unavailable to very large parts of the population, the worldwide population.